Okay, Ellen, now that we've finished the exam, and by the way, everything looks great medically,
Good.
I want to talk about a few other things. The first one is, how are you adjusting to parenthood? This is a big deal.
Actually, I'm feeling okay. I'm just a little tired, sleepy, and I feel like I don't have time for myself. But physically, I'm okay. I'm just tired. I'm very tired.
But what about emotionally? Becoming a parent's a big change in one's life, and this is your first child.
Yeah, it varies. It's right now I'm extremely worried about my child's future. I want to protect him. I want to make sure he's going to be okay. And you know, I have a history of child abuse, and that always keeps coming back every time I'm trying to feed him and trying to make sure that he's going to be okay in the future because of this crazy world that we're living in. So it is coming back more often than I thought it would be. So
I was wondering if that might be the case, because I do know that you've had a rough time in your childhood, and your Edinburgh screening test, which was that test that the nurse had you take when you first came in, shows that you're having a little more trouble adjusting than many ladies would. And that with your history makes me a little worried that you may be having some postpartum depression. So, are you eating okay?
I'm not eating healthy food. I'm not eating my regular schedules. Sometimes I eat my breakfast during my lunchtime. Between the baby and the lack of sleep, it's like I don't have time to go to the grocery store and buy healthy food. And when I feel that I have that time, I'm so tired that I just rather go to bed. So it has been a little abnormal.
Now, what kind of support do you have? I know your boyfriend and you live together. Has he been able to help some?
Well, he's a computer technician, so his schedule changes quite often. My parents, they have been very supportive. You know, throughout this past years, they've always been there for me when we had all the situation with the child abuse, but they don't live in town. So I don't see them every day, maybe once or twice a month. They're trying to make it more often because of the baby, but it's basically just me and my baby.
Okay. And I know you're planning to go back to work in, I think, another month, is it?
Yeah.
Have you made arrangements for childcare? Do you feel comfortable with that?
Not yet. We're looking at some options, but nothing is set in stone yet.
Is that a stressor for you?
It is, because I do want to breastfeed my baby. And right now I feel that, you know, I don't have time. I'm going to have to go back to work. I don't know if I have enough milk to feed him properly. I don't know if he's taking enough milk. My breast hurt, everything. So
okay. So I think we're getting a little bit more that this is hard work.
it is.
It
is
is
harder than I thought. So.
What about sleeping? I know the baby's waking you up at night and those kinds of things, but once the feeding's done, can you get back to sleep, or are you finding your mind's racing?
No, I try to get some things done at home, like, you know, cleaning the kitchen and some things, and try to organize some foods for me, for my lunch or my breakfast, but as soon as I have a chance, I go to sleep. And I'm so tired that I just go to bed, and I wake up when the baby is up. So,
well, I'm a little concerned, like I said, that you may be having some problems with some postpartum depression. You've taken antidepressants in the past.
in the past, I did.
And they, if I remember correctly, worked well for you. Do you feel that you're at a point where you might like to reinitiate that?
Not now.
Not now? Okay. I do think I'd like you to visit a little bit with our social worker, if you have the time today. She may be able to give you some ideas about childcare options, and at least be introduced to the skills she has, so that if you need more help in the way of counseling, she's a resource. And then plan on getting you back in a couple weeks just to see how things are going as far as your adjustment, getting ready to go back to work.
Okay. I don't have time today, but definitely that's something that I will
Well,
consider.
is it okay if I give her your number and she can maybe
Sure.
give you a call and figure out a good time?
Sure, that's fine.
Okay. Now, you obviously are worried about breastfeeding. You've raised that issue a few times. What seems to be the problems for breastfeeding that you're concerned about?
Mostly that I won't have time when I go back to work. Right now is just basically if I'm producing enough milk, if he's taking enough milk as well. So.
Well, there's a couple tips you can use for is he getting enough to drink? Because that's always a fear of most breastfeeding moms, because it's not like you have a bottle that you can measure, oh, he had 6 ounces or whatever. So if you can hear him swallowing, that's a good sign that he's getting milk. And the most important thing is, has he been gaining weight? I know you were at the pediatrician probably a couple weeks ago. How was that?
Yeah, we're doing good on that.
Okay.
Yeah, he's gaining weight, so.
And the baby being fussy and so forth doesn't necessarily mean the baby's not getting enough milk. Babies will go through little growth spurts, and there's a number of them in the first few months. And so then you may find you need to feed a little bit more often, but your body will adjust and make more milk. So don't worry about that.
Okay.
Now, one of the things that can help with the breastfeeding is try not to be sitting there solving all the problems of the world while you're breastfeeding. Try to let yourself concentrate on your baby and getting to know your baby and explore your baby while it's feeding, and concentrate on that and try to relax. Maybe put some nice music on, and that may help too, to give you a little respite from your worrying. Now, as far as going back to work, there's a couple things you can try. Getting one of those insulated lunch pails that you can put some ice in, or something to keep things cold. You can save your milk in that. Also, do you have an electric breast pump?
No, I don't know yet.
Okay. Let me plug you in with the lactation specialist over at the hospital. They can get you an electric breast pump. Some women find those work very, very well. Other women don't like them. I've had women say they feel like they're a dairy cow. And so sometimes the hand pump will work better, and that's another option. So when you go back to work, you can kind of figure out which one seems to work best at your workplace as far as pumping. So that may help a little bit with that. Also, the lactation specialist may have some other tips for the woman going back to work.
Okay. Okay.
Now, another thing I wanted to mention was your weight. I know you had talked to me a number of times during the pregnancy that you were upset about how much weight you were gaining, and we kind of got you into a healthy eating pattern. At this point, I don't want you to worry about your weight. You've got other things that are more important. Try to keep a healthy eating as best you can, and it's hard when you're just grabbing bites here and there. Maybe your boyfriend can go stock the refrigerator with healthier foods or things that are quick pickups. The other thing is, it's a nice time of year. Why don't you try taking the baby for walks? Again, that's an opportunity for the two of you to have some time together and get a little bit of exercise. And exercise in that way often makes you feel emotionally better too. So that may also help with the depression. So at this point, if it's okay with you, I'll give your name and number to the social worker. She'll probably give you a call, just touch base with you. And maybe next time for the next appointment, you can budget a little more time so you can maybe visit with her briefly. We can consider antidepressants if you need them, but you help guide me as to when you think you might need them. But it's okay to take them when you're breastfeeding.
Okay.
The breastfeeding seems to be going well. I'll make sure you have the little flyer to how to make an appointment with the lactation specialist. But I really think you're doing well. I think you're being very hard on yourself. And then the weight, we'll address that down the road.
Okay.
But you've got the right plans.
Well, that's good to know.
Any other questions for me today?
No, I think I'm good for now.
Okay, so let's plan on getting back together in about 2 weeks.
Okay.
Okay?
Sounds good. Perfect. Thank you.
Great.